Like most of you, I've been watching Foodie Beauty and just sort of shaking my head lately. I think I finally put my finger on it. It's the gaslighting that's getting so frustrating. Her diabetes diagnosis has done very little to change her lifestyle, and that's what we're sort of watching right now, a very slow train wreck. We're at the point in the cycle where she's starting to confess things, so the situation becomes much more clear. Let's take a look.
It's 10.4. Despite eating very poorly yesterday, I attribute that probably to my medication and the increase in exercise, but who knows? It fluctuates. So 10.4 is my fasting reading today. It is 3 p.m. I did not eat yet, and that's because I ate too much last night. So this is the reading.
Okay, so did you notice the point where she said it's 10.4 despite the fact that she ate badly last night? That means that she thinks 10.4 is actually a good reading. Now, we don't know what parameters her doctor discussed with her for a fasting blood sugar, but when you consider that normal is 100 milligrams per deciliter, at 187, she's way off.
Tomorrow is weigh-in day, and I expect it not to be as good. I don't expect to have a loss, maybe a slight gain. I don't know. Maybe not from actual fat, but I think if anything else from retaining water, because I eat so much sodium. I have eaten so much sodium, particularly yesterday. Yesterday, the day before, so for about 3 days now, I've been slipping. I'm in that stage right now where, I start off going strong, and then I start slipping. Things get a little tough. You kind of just get sick of it. And it's so easy to fall back into old habits and to just give in to urges to overeat. And the B word, we're going to call it the B word, which is like code for binge eating. So I had nightmares. I was so thirsty. I felt really gross and dizzy, and like if I wasn't taking my medication religiously, for lack of a better term, I don't know, my blood sugars would probably be an emergency at this point, because like I wasn't feeling good already. And so the medications, I know, definitely helping, especially when I eat things not good for me. So what else? I had TMI, but the worst, going to the washroom. Nausea. I thought I was gonna be sick many times, and just poor sleeping. Headache, a really bad headache from the sodium, I'm sure. So it's not worth it. Like, I'm paying attention to how I'm feeling after, and it's just not worth it. It's not worth feeling like absolute crap. And it's not worth it for me. No. And sometimes it doesn't change the urges, but I'm gonna remember how I felt. I'm gonna really try hard and undoing all the progress that was so hard to do. So yeah, I'm gonna be back on track. My blood sugar reading, you saw at the beginning, was 10 point something, which is not bad. Like I said, my sugars before consistently being back on my medication were like 23, in the 20s. It was bad. Never below 15 usually. So I just gotta stay on it and stay consistent with that and get back to walking probably tomorrow. I'm not feeling the greatest today.
Okay, so this right here is where I realized just how bad the gaslighting was. Foodie's remembering that her blood sugar was 23. It was actually closer to 24. This was the reading that they got in late November at the Kuwaiti doctor's office, where they talked to her about diabetes the first time. Coincidentally, her blood sugar was also 23 when she went to the ER in Canada. So whether she realizes it or not, Foodie has established a baseline for her hyperglycemia that kicks in right around 400 milligrams per deciliter. That's when she feels the symptoms badly enough that she'll seek medical attention, and that usually ends up being 1 or 2 injections of insulin. This has happened twice already, and she just doesn't see the pattern yet. So if you haven't figured it out yet, then that means that Foodie has pretty much made herself insulin dependent. While the oral metformin is helping, it's just bringing down her fasting blood sugar a tiny bit. You can tell this by her A1C readings. Back in November, her A1C was 10.4%. That number gives the doctor an idea of her average blood sugar over the previous 3 months. An A1C reading of 10.4% means that her average blood sugar for the previous 3 months was over 13. So 10.4 is a small improvement, yes.
Like, setbacks happen. I would say I started slipping probably with the Taco Bell. That was probably the first real slip. And then, I was like, pot pie, I'm craving pot pie. All of these things that I was like pushing away in my brain were like, ooh, so since you had Taco Bell, can I come in too? So yeah, in theory, having a small piece of pot pie with some salad or vegetables wouldn't be that bad, but again, that's, I think, one food I just can't control myself over. I see this huge tray, and I'm like, I know that I could technically, I'm an adult, I could do what I want. I could eat the whole thing, I could eat the whole thing. I would feel sick, but I could do it. I have done it before. So,
the reason why I titled my video the way that I did is that in her body, Foodie's diabetes simply doesn't care. I get this comment all the time on my videos, and I really couldn't agree more. Her body really doesn't care if she eats chicken pot pie or Taco Bell. It simply can't process the excess blood sugar that she produces. In preparation for this video, I called up a friend of mine. We'll call her Melissa. Now, Melissa has type 2 diabetes, and she's been dealing with it for over 15 years. I've known Melissa this entire time, and I can tell you, over the years, she has lost a ton of weight, and she's not nearly as big as Foodie. You know what else? Her diabetes didn't get better, it actually got worse. She's taking up to 5 medications now, including injectable insulin before each meal and 1 injection every day. So when it comes to treating her diabetes, Foodie simply isn't seeing the forest for the trees. In this article by the Mayo Clinic, the authors describe how diabetes is treated using insulin to manage blood sugar. Basically, patients can be prescribed long-acting insulin and quick-acting insulin. In the case of my friend Melissa, and probably Foodie, you could also be prescribed a combination of both. So in a nutshell, Foodie's lying to her doctor in Kuwait. She didn't tell him about her eating issues, and she's not being able to stick to any of his guidelines. So, without any sort of diabetes education, she's just holding off the inevitable. It's kind of silly when you think about it, because she already knows that insulin will help. She seeks it out when she goes to the emergency room. She just doesn't realize that that's what she's doing. She's basically asking for insulin, but she also wants to have her cake and eat it too. Literally. Now before I go, I wanted to tell you about a show I've been watching. I actually just finished it, and it was kind of life-changing. It's on Netflix. It's a docuseries called You Are What You Eat. In a nutshell, it chronicles this scientific experiment using twins, identical twins, and changing their diet. In the course of 8 weeks, one twin is given a vegetarian diet, and one twin is given an omnivore diet with meat products. During that time, for the first 4 weeks, they're given boxes of food to eat, and in the last 4 weeks, they have to learn to cook for themselves, similar to the meals they were provided. During the experiment, they have extensive education, including meetings with a physical trainer who works out with them at the gym. So it's not just about food, but also about their overall wellness. And as you can imagine, the twin with a vegetarian diet does much better. This is measured both before and after the experiment with full body scans, showing the body composition of muscle and fat. Now we all know that Foodie's not going to go full vegetarian, but my point to all of this is that in order to see any sort of real differences, She has to make significant changes in what she eats and how she moves. And if this documentary is anything to go by, she'll need to do it for at least a few months to see real significant changes. So every week that she spends not going to go back to the doctor is just putting off the inevitable, and all we're doing, again, is watching her train wreck. While I know that a lot of this is deflection from the cheating scandal, that doesn't change the fact that basically all we're doing is watching somebody who's overweight and in denial about her diabetes. That's it. It's not really that fascinating if you think about it. Drop me a line in the comments and let me know what you think. I'd love to hear from you.